Well, thank you for agreeing to talk with me, and congratulations.
Thanks, Paul.
You've been told this couldn't be done. You've been told this shouldn't be done, yet it's done. So how does that feel?
It feels good. Actually, I was talking with Tom Curran, who sends his regards, by the way. And, we were laughing because, in retrospect, we probably agreed with the folks that were giving us that advice. If we'd have known everything that we had to go through, but luckily, I think we were just naive enough and stubborn enough that we kind of like Elizabeth Warren, we persisted, and we just kept at it. So.
Well, the difference is that you got the comprehensive, and she's not president of the United States.
There you go.
Yet. So, no, but actually what's fascinating with all of this is that how long did it take from the beginning to now?
Well, it was, so I got here in 2004, so roughly 18 years.
18
In fact, almost exactly 18 years.
Oh my. And if we were to break it apart, how long did it take to get designation, cancer center designation, and how long did it take for comprehensive?
Yeah. So it took 8 years to get designation. We got started in 2004, got designated in 12, and then of course we were in a situation in 2017 where they kind of moved the goalpost on us. They decided to codify the rules around moving to comprehensive status and to require that clinical cancer centers had to be designated for 10 years before they were eligible for comprehensive.
So you got it exactly at 10 years.
Yeah.
So that's pretty fantastic. What was the hardest thing about all of this?
I think there were a lot of great things happening in the Kansas City region when we got started, but there still was a lot of misunderstanding about NCI designation and cancer centers and what it would really take, and a lot of cultural shifts had to take place, and recruiting people in who had been at NCI designated centers was frankly one of the most crucial things, because you didn't have to explain a lot of things to them, and they just knew us. Yeah, we got to do this, that, or the other thing. So Andy Godwin, fantastic recruit, had been at Fox Chase, knew exactly what cancer centers were all about, knew what had to be done, and he just you chat with him for 5 minutes and bam, he's off, and he's doing his thing. Danny Welch, another great recruit, helped build our basic science program. Weijing Sun, Shri Anant, all of these folks were just fantastically talented, tremendously energetic people. And of course, Scott Weir, who is the core of our philosophy around building drug discovery expertise within a cancer center. And Scott really led that whole idea and helped get it started. And of course now we're that's one of our pillars of success, without question.
One of the people who did not understand what you were doing was Benno Schmidt, who understood many things. On that one. So if maybe we could just
I missed an opportunity. I should have invited him.
Well, he's otherwise occupied.
Yeah. Well, it's like I said, a lot of people who were giving that advice, back in 2004, 2005, I think, I think they were right. I think the issue is they couldn't see the place changing, and they couldn't envision that sufficient amount of change would happen that it could be within the realm of possibility. And if you just keep plugging and don't give up, eventually people say, well, you know what, try it your way. And that's kind of what happened.
Well, it's fantastic that we have done the Q&A for the Cancer History Project, which was very, very detailed on all of this.
Yeah.
So I hope folks click on that and see what it took. Just really full of great stories. But let's get into the politics of medicine, of oncology locally.
Yeah.
What was the shift? Because there's seismic.
Well, I think KU was sort of an interesting institution in that they were not the dominant medical presence in the town, and that was there were a couple of other private hospitals that really kind of ran the show around here, and there are a lot of reasons for that. Basically, KU was coming out of a period of about 20 years of not great leadership, and the place had gone downhill significantly, and there are all kinds of state rules and regulations that prevented them from really operating in a modern healthcare environment. And so I think there were two catalyzing events that got things going. One of which was the hospital breaking off and being able to, build a functioning, revenue generating, margin generating system. And with no margin, there's no mission. And that was certainly true at this place. And then I think another key event, of course, was the Stowers Institute. And Stowers Institute was kind of like a rock dropping on Kansas City's head, and they discovered that you can biomedical research is a great way to build an economy. And they got with a program, and they started designing all kinds of programs like the Kansas Bioscience Authority and things like that, which started injecting real money into building the biosciences here, and they were key to moving us forward. And so, Kathleen Sebelius and her administration were really key. And so it was more than ironic when she became Secretary of HHS and came back and announced our designation in 2012. I couldn't have had a more fitting person.
Well, plus the cancer care all over Kansas and parts of Missouri has changed from community-based to really academic and community-based. So that's an enormous achievement.
Yeah. Well, I think from the very start of our cancer center, we were quite cognizant of the fact that we have this absolutely huge catchment area, that spans the entire state of Kansas, the western portion of Missouri, and that we needed to build the infrastructure to reach those folks and to leverage a lot of the great work that's going on in these community hospitals and be a benefit to them, as opposed to taking market share. How could we figure out a way to help them provide better care, provide access to clinical trials, provide access to expertise, and keep keep care close to home. And that's what the Masonic Cancer Alliance was focused on from day one. And then of course, the other thing that was really fortuitous for us was that became a focus of the community outreach and engagement component of the P30 grant. And so we were loaded for bear on that, really from starting in 2007 is when we began developing all of that.
Should there be a limit on the number of cancer centers that NCI should designate, or should this be more is better?
I think the key thing there is being able to demonstrate a real need in the community to serve people where they are. And the two articles that came out in the last year that documented the catchment areas for all of the cancer centers across the country and showed that there are still significant regions where there is a lack of coverage is the best answer to that question, because I think that there are still places that don't have access or ready access to the great care that's provided at an NCI-designated cancer center.
But as far as you're concerned, is there more catchment area you can take on? Is there anything more you can do that you're not doing?
There's a lot of discussion about that in the cancer center community right now. And, one of the things that's holding centers back is, and I've seen this, at site visits, where cancer centers expand their catchment area with the best of intentions, and then they get slammed by the reviewers for not having the full range of services extend across their entire catchment area, and specifically in the new areas of expansion. And so from a grantsmanship standpoint, I certainly understand the reticence of cancer center directors. I think that we should be figuring out ways to incentivize centers to take on those challenges and to expand and extend their reach into the community.
Well, Utah just had a gigantic expansion, and Fred Hutch just had a gigantic extension. Is there
exactly
can you go down that path? Is there any path that is good for you?
I think that my hat's off to those two places, because I think that was a bold move and absolutely appropriate. One of the things that we could look at is extending, farther east, and I think there's some potential there. I would say that we were somewhat conservative in drawing our catchment area. It's largely based on the patients that come to our center right now. So 95% of the patients that are in our cancer center come from the catchment area that we've drawn. I think to effectively serve more folks in central Missouri, we'd have to look at trying to establish outpatient centers, and I don't know if that's a direction that our health system wants to go in right now.
What's your next challenge? What's next? You've just done this. That's not small.
Well, I think we have the next biggest challenge for us is looking at a signature cancer center building on the medical center campus. Right now, and we were, and we have plans for that. And I think that was one of the reasons that we did pretty well in our review, is because we had addressed a very significant concern that had come up at our last site visit around the fact that, you know, when you walk on our campus, it's difficult to point to the cancer center. You know, we're in like 12 different buildings. But that means that we have not been able to aggregate all of our investigators, whether they're basic scientists, population scientists, or clinicians, in reasonable proximity to one another. And you know, the site visit team back in 2017 said this, you know, this is a big problem. You guys really are leaving a lot of collaborative opportunities on the table if you're not physically together. And so we have been looking at how we can do just that. How can we build a building that you know, brings that critical mass of folks from all the different disciplines together? And we have you know, we have some plans on the drawing board to do that. And now my challenge is going to be to identify, you know, funding for that, and to settle on the exact configuration of that facility with our health system partners.
Mm-hmm. So you need a few million, quite a few, to do that.
Yeah, it's going to be a several $100 million building.
Yeah. Yes.
About it.
Sounds like it would be quite fascinating. So how are you celebrating this? What will you do? Are you?
Well, we've got a couple of events. Tomorrow we have a press conference where we're going to announce comprehensive designation, and we've asked Jerry Moran to do that, and he readily agreed. And so we're going to have, I think, probably around 250, 300 people at that event. And we were kind of limited by the space available there. And then we're in the afternoon, we're very excited about having a party out at the Sporting KC Stadium, which is known as Children's Mercy Park. And we've been working with them on an event out there that's going to be a lot of fun. And pretty much we have space to accommodate everybody across the whole cancer center out there, and it'll just be a celebration of what all these folks have been able to achieve over the last couple of decades.
Well, what about you personally? Where are you going? You're going to take a couple of weeks off, go someplace nice?
You know, I after the site visit, I took a week off, and we rented a VRBO in Exuma, and that was fun. We had the whole family there, and that was like the best vacation we've had in a long, long time, because between COVID and you know, getting ready for the grant and the site visit, it'd been a while since we've been on vacation. Mm-hmm. So we'll probably start doing more vacation types of stuff now that this is behind us.
Is there anything we've missed? Anything we forgot? Any words of wisdom for other people trying to get a comprehensive designation?
You know, I guess I would say that I've now had the privilege of being witness to two institutions getting designation, and watching the transformative effect that had. So both here at KU and at Vanderbilt, it really is an astounding process that takes place in terms of the institution preparing themselves to be at that level, and then watching the impact that has on the quality and the delivery of patient care. You know, you're able to attract the best of the best. to your institution. And those are the folks that, you know, your cancer patients are putting their trust in, and it's really well deserved, because they are the experts. They're the national experts, they're the world experts, and it makes a huge difference in the quality of care that you can deliver. And I think it's worth it.
Well, thank you so much for talking with me.